Order, St. Croix EMS. We're going to reverse the order. So we're going to do Operations Supervisor's report first.
All right. And see, last week we hired a new full-time paramedic, Jared Mallard. So he's started his training process, hired 3 new EMTs as well, and everybody's currently on the truck training. We have received 2 more full-time applications and 1 part-time application for paramedics, so we're going to be interviewing those this week. Staffing is getting better. Schedule's starting to fill up pretty good for the month of October. 5182 is getting close to being done, the remote through Everest. Working on a schedule to reduce the medics' times working, from 24 on to 12 off. So we're working on a schedule to combat that. 177 calls for the month of September. 28 of those are being transfers, so we're averaging 5.9 calls per day. We have 68 calls so far for the month of October, 16 of those being transfers, so we're averaging 8.5 calls per day. 5 transfers are given away so far in the month of October. We had 14 calls for service on last Wednesday. We did 14 calls, so it's a busy day. Still working on the 2019 budget. Unable to get a meeting together with Lakeview and Hudson Hospital due to scheduling conflicts with everybody. Staff is still very concerned in regards to the EMS contract talks and the RFP that was discussed at the last City Council meeting. And that's about all I got.
Okay.
Can I ask a question? So with the new time hires, so where is our staffing levels? Are we still down?
If we hire another paramedic, one of the full-time paramedics will be up to 4 or 5.
So you're currently 1 down?
Correct.
Gotcha.
And then EMTs, we can still hire them until you're blue in the face, and we'll be okay. We'll probably need another good 4 or 5 EMTs to fill everything out.
Gotcha. Beyond the 3 that you just hired.
Yep.
Are we running any situations where, since you're down with the EMTs, where you're not able to do any transfers or any other calls?
There's a couple transfers that we have missed has been due because we've been out on other calls already, or been on a transfer already. So, and a lot of that's up to the docs in the ER that determine how long they want to wait for, transfer or a truck to come there to do their transfer.
So it hasn't been specifically because of staffing?
Correct.
It's because
we're busy.
Any other questions of Josh? Thank you very much. Medical Director's update, there isn't any, I assume?
Oh, he's here.
Oh, you are. You are. We asked you to come. Your thoughts?
Podium, please.
So thank you. So I'm Aaron Bernard. I'm the medical director for the service. So you saw my medical director's update from last month. I just wanted to stress that I had concerns about the staffing level, and like I mentioned, we had paramedics who were stepping up to the plate and helping to fill shifts very honorably, but some of them were working 72 hours at a stretch, which is just too long in my opinion, and really not safe. So I've been working with Josh to address that, and it sounds like we have some hires coming through, which will be very encouraging. But it would just be my recommendation that we really limit continuous on-duty hours to 24 hours at a time. I think that's the best practice in EMS, and as our service becomes busier and busier and busier, we're a critical care staffed ambulance, asking our paramedics to perform at the critical care level. And I think limiting their on-duty time to 24 hours, followed by at least 12 hours off to ensure that they're getting good rest and they're not showing up tired, is really what's going to lead to the best outcomes for patients. So that's the goal that I would ask that we work towards.
I have a couple questions for you. Hi, I'm Bill.
Yeah.
The first question I had was, when you saw the staffing levels, when was that through the time of Brandon's resignation and through Joe's resignation, kind of?
I had just reviewed September 2018.
September.
Because I was aware there were shortages with the 2 FTEs down.
Right, okay. And then what sort of Is there any difference between your guidance and sort of state guidelines within the state of Wisconsin?
So that's a good question. I guess I'm not sure what the state of Wisconsin requires.
Gotcha. Josh, do you?
The state mandates no more than 36 on, without 12 off in between.
So I guess the state mandates 36.
Gotcha. But your concern is specifically, my understanding is for sort of the size of the community and how much we're covering, that is why you're giving the guidance to 24 versus 36?
Correct. I think there's two main points. So one is the service becomes busier and busier with call volumes continually going up. So it's not the service we were maybe 10 years ago. The second is we're functioning at the highest level, a critical care advanced life support level. If this was a basic life support ambulance who was doing half the calls we were, I think my guidance might be different. But that, since we're functioning at the highest level and we're getting busier and busier, that's where my guidance comes from.
Gotcha. Thank you.
Any other questions?
And then Dr. Burnett's here. I handed out, I know Tom from the hospital had questions as far as how interfacility transfers work and the guideline. This is the guideline that Dr. Burnett and Regions Hospital put out to, at least to Hudson Hospital and to Westfields.
I can work through it if you'd like. So Wisconsin is unique in that there's statutory language around what requires a critical care level interfacility transfer. That's different than, say, Minnesota, which doesn't. And so that does lead to some confusion at times regarding what can go by a, if you will, a standard ALS ambulance, what needs a critical care staffed ambulance, and then what can go by a basic life support ambulance. Because as we're able to get the appropriate ambulance to do the appropriate level of care for that transfer, if we can get it done at a basic life support level, we can keep our paramedic, medic aid in service in town. So this was designed to really help the hospital, to help the physicians kind of work through what level of transport is most appropriate, and when possible to keep it at the safest but the lowest level that will get that patient there safely. So when we can utilize a BLS ambulance, we're encouraging the hospital to do that, to keep our ALS resources in the city. Because obviously our interfacility transfers are going to the Twin Cities, which is a little bit of a drive. And so this is being employed at Hudson. It's currently being rolled out at Westfields. We're working on it in our other Western Wisconsin hospitals. But as you can see, some of this was also designed to help set some sort of appropriate expectations for the hospital as well. So if you kind of follow to the right-hand side where it says non-emergent transfer, we also work to help set some expectations for the hospital that if you're requesting a non-emergent transfer, it's reasonable to have to wait 1 hour for an ambulance. If Hudson comes back and says, it's going to take us 45 minutes to get there, and this is a non-emergent transfer, that's a reasonable amount of time to wait. You don't necessarily need to go to the next one down the list.
Okay, thank you.
And who makes that call?
The physicians, ultimately, the treating physician is the one who has the final authority. We encourage them to use this guideline.
Gotcha.
And that's actually by federal law, by EMTALA, requires that whenever there's an interfacility transfer done, the transferring physician has ultimate responsibility of that patient all the way up until they're accepted at the receiving hospital. So that transferring physician is technically responsible while they're in the ambulance until they get to the final destination.
Gotcha. So walk me through, okay, so let's say there's an emergent need, they need to be transferred.
Sure.
The doc is hearing where these ambulances are and saying, oh, it's okay to wait, it's not okay to wait, call the next one on the list. Is that a possible conversation within the hospital?
Yes, I think it is. The ultimate final decision rests with the physician, because you can imagine there could be a circumstance where, according to this guideline, we should really be sending someone by a critical care ambulance, but we might have a Hudson crew who's maybe staffed at the paramedic level, but not the critical care paramedic. And they might be in the ED and say, hey, we're available. And the doc might make a judgment call and say, the best interest of the patient is for this crew to take them right now rather than waiting 10 minutes for a critical care ambulance. So this is a guideline. It's not a hard and fast protocol.
You said that in Minnesota, a critical care is not required?
It's not even an identified level by the state. There's no, people can put critical care on their shirt, but there's no state recognition of that.
Okay. Are we operating at the critical care level here?
Yes.
We are, yes. Which is the highest level in the state.
But that's a separate certification or beyond just a regular paramedic, I shouldn't say regular, but
911
paramedic, right?
Correct.
How many of our paramedics are critical care?
All of them, all of our full-time are.
Got it.
And I'm pretty
Even the
sure.
new hire?
He's a new hire? No, he's not.
Okay.
I don't
just
think.
wanted to know.
The one, I don't think he is. He might be, I don't know. He's worked in the state before.
Okay.
So I guess I'm not sure if he's critical care or not.
Just for my knowledge, is that a separate licensure? Is that, I mean,
Yeah.
what goes into that?
Certification?
Yeah, it's additional education that they have to do, and then it's formally recognized by the state.
Is it a certification or?
It would be a certification, yeah. through the
That's
state.
something that has to be kept up?
Correct.
Gotcha, so,
And it also impacts billing. So when you do an interfacility transfer at the critical care level with a critical care licensed and staffed truck, you're allowed to bill a supplemental critical care charge, which is not authorized if you're transferring at the routine 911 paramedic level.
gotcha.
Who is that training done through, Josh? Is it through WITC or through the?
Some's done through WITC, some CVTC. Stefan, one of our full-time medics, is finishing up his critical care right now, and he's going through Hennepin County.
Hennepin County? Okay.
So I'm going to ask an odd question, right? Because the second one down on the list is Lakeview, right? And they're Minnesota-based.
Correct.
Do they have to have the critical care certification as well, or are they sort of?
They're critical care licensed in Wisconsin.
Oh, they are. Okay,
They are.
so they have to be. Okay, that makes sense.
And we mandate within a year of hire here that you become critical care. And of course, we pay for it, so
Right.
since we mandate it,
Gotcha.
or require it, I should say.
I got another question. It's a little bit off the wall. But when I got involved with EMS services, I was a little shocked. And so this is, I'm prefacing that to ask my question. Are any of our full-time paramedics also working full-time someplace else? And it goes to his question about being off for 24 hours.
The new hire is.
The new hire is? I was shocked at how many people do that in the emergency medical services field. It's like,
And everybody,
really?
everybody pretty much works. the
I
same
know,
way.
and that's why I was shocked at that. You know, I just didn't realize that was the case. So how does that play into your concerns, Aaron, if, you know?
Well, my recommendation would be after, a 24-hour shift, we need to ensure those providers have 12 hours of not working, 12 hours to rest.
Okay.
And I would feel that would be inclusive of other employment opportunities. I mean, my single and primary concern is making sure that, our critical care paramedics who we're tasking with the most complex and delicate procedures allowed by law in the field, are not fatigued, are not tired. There's good medical literature to back up that medical fatigue leads to errors, specifically in EMS, and so that's a real concern of mine.
Okay.
And I think 24 hours on followed by 12 hours off, back to potentially 24 hours on is acceptable. I think it's still an aggressive schedule, but it's acceptable. But I feel strongly that we need to ensure that our providers are getting adequate rest in between shifts, especially as our call volume goes up, especially as we're operating at a critical care level.
Just so, Bill, one of our concerns as we grew, like he was talking about our basic level services, we grew, people always used to work full-time and they'd sleep here. And they had another full-time job during the day. Well, all of a sudden, we got so busy that they weren't getting their sleep at night and they were going to work tired. And it just wasn't working out, that they couldn't work two full-time jobs and exist. You're too tired, That's part of growing pains with the services we grew with, number of calls.
And currently, the 24 hours, they're staffed here in building?
No.
Okay, so,
Medics are allowed to take chase vehicle and go home.
gotcha. So within that 24-hour period, they're not here working necessarily,
Correct. They're working, but they're at home, working from home.
as an on-call basis or
As an hourly.
as an hourly? Okay.
So
But they're
allowed-
waiting for a call.
Correct. During the day, they're required to be here during a weekday, at least 8 to 4:30 during normal business hours. Outside of that, they can be at home.
Right on.
Unless they live, obviously if they live out of town, then yes, they will be down, they'll be here working.
Sure.
Any other questions for Aaron? Thank you, Doctor.
And just the other sheet I handed out, it's
Yes.
just a brief little explanation of how transfers work for us. That's in our operational plan with the state, so. We have to have a truck, obviously, for all 911s. Transfers are considered, you know, like a bonus
Okay.
for us, so.
That should be good. Thank you much.
Thank you, it's very helpful.
I do appreciate you being here. I didn't realize how critical it was for a discussion period, but it was. Thank you. 9, discussion and possible action on 2019 budget and discuss possible action on 2019 staffing.
We're working on the 19 budget. Maybe Josh can explain the staffing model that he wants to implement for next year, and that's where we'll start with it.
So, gonna pretty much go back to kind of the old way. So go back to the 2 full-time medics and then the 3 EMTs on the truck. The first option I had was the 3 EMTs on the truck, 2 medics, and then staff a transfer medic. That would be, I don't know, what we decided on, like $5 an hour to be on call from home or whatever, and then that gives them the, once we get a transfer, whether if it's non-emergent, that gives that medic 20 minutes to respond into the city and get up to the hospital to take the transfer. The other option is pretty much the same, but no transfer medic. So with the 3 EMTs and the 2 paramedics, that'll give us enough people to staff at least 3 trucks, but it also gives us enough to run transfers too and not interrupt the normal 911 staffing. EMTs will be moved back to a stipend rate, and the medics will stay hourly. The only difference is during the week I took the backup medic stipend out. There's a lot of medics that wouldn't come in and work the night shift because they were getting paid right around $8-9 an hour less than the primary medic that was working at night. So took that away, and seems like people like to come in and work the backup medic spot at night, so it seems to be working so far.
Okay.
So you've gone to that model since?
Yeah, but with just 2 EMTs. We haven't put a 3rd EMT out yet, so.
Sure.
I guess, how does that impact the expense that we would incur?
The $5 per hour for the transfer medic, we've had discussions about that, and we need to work that in the budget if the commission wishes us to move forward on that. As we realize, the budget at this point is very fluid, and so once we get some responses back on contracts, we can kind of move forward with that.
But correct me if I'm wrong, the difference between the model that we were on before and the one that Josh has suggested going to is fairly flat?
It is fairly flat except for this $5 per hour for transfer medics. So I need to know if I need to work that in or not.
Okay.
How does,
And I can bring 2 options back on that.
how does that $5 medic fit into this?
What do you mean?
Well, you need a paramedic for EMT and critical, for ALS and critical care, right? Mm-hmm. And so if the hospital calls for a transfer, and it takes him 20 minutes to get here, plus get up to the, how does that fit into that model? I'm just trying to understand.
I talked about it at one of the last EC meetings up at Hudson Hospital, which is emergency department meeting, and I talked with Dr. O'Hay and with Lisa, the ER manager, and they liked it. Dr. O'Hay said he wouldn't foresee a problem in waiting that 20 minutes to ensure that we're getting all the transfers out of there.
Is it 20 minutes from home to the hospital?
20 minutes from wherever they're at.
To the hospital.
Correct.
Okay.
And
Just
then,
trying to understand that.
Yep. If it's an emergent transfer, then obviously one of our crews that's here will take it. The primary crew will go up, and the transfer medic will come in and back.
Well, he'll serve as backup after that then?
Correct.
Okay, I wanted to know if that was what was going to happen.
Yep. So if it's an emergent transfer that needs to go now, crew, the primary crew will go up there, take the transfer, the backup medic, or the transfer medic will come to the station and fill until that transfer gets back.
Okay.
So they're making more once they're transferring, right?
Correct, they'll go to an hourly rate once they take a transfer, which I think we figured, what we figure, Brenda, an hour? 2 hours at the
2
most?
hours.
So as I understand it, going with the stipend for the EMTs and hourly for the medics, we're basically going back to the way it was before, and we felt that that was more conducive and better for recruitment and retention, right?
Correct.
Okay.
It gives everybody a little bit of freedom. You know, they're allowed to stay at home if they can. You know, like Tim brought up earlier, a lot of people work other full-time jobs, and they're away from home already for, 8, 10 hours, whatever it is. It's a lot easier if we say, hey, you can come work here, and then, you can stay at home as long as you, get to the station in the required amount of time. So it's a lot easier on people. It lets people pick up more. They can go home and sleep in their own bed, or, go have dinner with their family, or hang out at a birthday party. So it just seems to work better. I don't think our numbers are high or are busy enough right now to be really pushing, at this point right now for full-time trucks.
Is that why? Because that's leading into what I was going to ask, and that's why did we go to that model? Is it because we were anticipating reaching the volume that required full-time trucks?
It's not a question I can answer.
You were with Brandon. You would put the budget numbers that way. Why?
The former director, he felt that the model that Josh is requesting us to go back to wasn't working. We don't know if that was an operational thing or if there was more involved in that at this time.
But didn't he, I'm sorry, I didn't interrupt. Didn't
okay.
he estimate higher call volume, though, and base that sort of around that, where we're not seeing that higher call volume?
He was having problems filling shifts. And so he felt that the model that he recommended with adding the full-time paramedic per year and the hourly EMTs would get us a better response time, and he would have less difficulty in filling shifts.
I want to make it clear. The model was not the problem. The crew had intentionally held off and not taken shifts, is the way I understand it. I don't think that was fair or right to the service for the crew to do that.
Well, I wouldn't go that far, but
Well,
the biggest,
you can't tell me, Josh, that all of a sudden we're filling staffs and hiring people because the model changed.
model
And I
hasn't-
know
model
that the
hasn't
minute
changed yet.
that he left, people started filling shifts that weren't filling shifts for months.
The biggest hit to the model was the hour caps for the EMTs.
Well, that helps, but that wasn't the issue. I'm sorry, I don't believe it was. I might be wrong, but I don't think so.
You're entitled to your opinion, so. It is what it is. I mean, with all, I'm surprised,
know it is what it is.
we're getting people to apply with all the bad press that's in the paper now.
I agree. I
So,
agree.
But
I remember the stipend, when the stipend went away, that was a huge hit. Is that correct?
when the EMTs went to,
When they had to be on site.
Correct.
And only could be on site, or only could do a shift for,
they can only do no more than 24 hours a week, or a maximum of 30 hours a week.
gotcha, versus a stipend model, which they're able to do how much?
Whatever. And we had some that were working, 60 hours a week.
I'm still
greater.
not understanding it. And you got to help me through this because it was full-time staffing levels, and it was a model that the state said we can't hire them and let them work that much or we're going to have to pay them benefits. How
Because
is
we went
that?
to, the 2018 model went to an hourly rate, and so
Right.
we had to keep their hours below.
Rather than stipends.
Right.
And it
And
would
we
be,
did that, why? Because of the level of service we were providing for the number of
The
calls?
former chief felt that if we mandated every EMT to work a minimum of 24 or a maximum of 24 hours per week, it was easier to fill the schedule. Because you know you had a group of people that were gonna be here for 24 hours this week. Versus pretty much, you know, letting people sign up to work their stipend shift the old way.
So if we had EMTs that were working 96 hours in the old model with stipends, that was, in the new
24.
model, it'll be okay with 24 hours on and 12 off? I'm asking is all. I'm
And
trying
it's a
to
good
understand all
question for
this.
the medical director. We talked about paramedics, that they could work 24 hours, and then they needed 12 off. Another good question would be, is that the same that we need to do with
EMTs.
EMTs?
We would assume the EMTs would be going on the same number of calls as the paramedics, right?
Now there's 3 that will rotate through a 12-hour shift.
I mean, the EMTs are tasked with driving the vehicle mostly on high acuity calls, and so there's good data on fatigue leading to increased rates of vehicle crashes too. So I think my recommendation would still be that we limit continuous work hours on duty to 24 hours. While the medical care provided by an EMT is at the basic life support level, the lights and siren driving through the community is the same. And so I think my recommendation would be the same, would be 24 hours of continuous on-duty service followed by a mandatory 12 off. And again, they could go right back to a 24 at that point, and I would consider even that an aggressive schedule, but I think it would be safe and tolerable.
Okay. Thank you.
Does that change your staffing with EMTs?
No.
Okay.
Okay. I just was trying to understand as we're rolling the model in different directions, you know.
And I feel a little worried if it just feels like we're chasing our tails. If we're going back to the original model, there are reasons why we left the original model. We're going back to it. It may be better than what we currently have. We're going to end up right where we started.
My biggest decision to do to that was we need to put the brakes on a little bit. Obviously, we have a great big humongous mess with the EMS contracts, and with losing the town of Hudson, or the possibility of losing the town of Hudson, I felt that we need to put our brakes on, try to get our feet back up underneath us, take a look at what's going on, take a look at our service, kind of watch it a little bit, and take a good look at it before, you know, we start blowing everything out of the water. And, you know, in 5 years from now, you know, we got a ton of full-time staff, or 3 years from now we can't afford it anymore. So that was my decision, was to put the brakes on, slow down, get our feet back up underneath us, take a good look at stuff, and figure it out as we go.
And don't get me wrong, I totally agree, something has to change, and so we have to do something. And so I'm not necessarily opposed to it, I'm just worried that we're going around in circles. So.
Okay.
So then my other thought was, can you go back to and I don't want to belabor the point, so, but why did we decide to change the original model? What was the underlying point that?
Difficulty in filling shifts.
So the success of the model that we're reverting back to is predicated on the assumption that we'll fill the shifts that we weren't filling before.
Yes, and but that was under a director that's no longer here.
Got it. Okay.
Okay. Any other questions?
Do you want me
So-
to, when we go forward with budget, do you want me to do 2 proposals based on the 2 full-time paramedics and 3 EMTs on a truck, and then do another model of putting the $5 per hour for the transfer medic, and bring back 2 models at some future date?
The future date would be the 23rd?
That's our next
That's
meeting.
our
Is that our
next
next meeting?
meeting.
Yes, at the 23rd.
Okay. I'd say so. Does anybody else have any feelings on that? Okay,
Thank you.
thank you. Update on RFP for billing company.
I heard back from the billing company mid last week. I haven't had a chance to review their email, but I'll be doing that. Just a quick read through the email of things that we had proposed. A lot of changes. They're only proposing a few changes, and so we're moving forward with it. But as I've talked about, they are billing us under the new contract, which is great because it was a 1% reduction in their fee.
Good. Thank you. Do you have any idea when? Month, 2 months?
I
By
would
the end
hope
of the
that we
year?
could have it to our attorney next week to review.
Okay. Thank you. Any other questions?
I do have a, sorry, Brenda. When you say 1%, can you put that in dollars?
$10,000 per year savings.
Thanks.
Anything else? I assume that's it. Discuss possible action on interim chief position. I don't know anything.
So this kind of relates to number 5 as well. And so we could probably just have that conversation when we move to number 5.
Okay. Discuss possible action on non-renewal of ambulance contracts. City received a letter from all 3 of the partners, correct?
Correct. We received a letter from everybody. One thing that we didn't talk about was the minutes from the last meeting, right? We didn't.
Right.
We're going to do that at the end.
Yeah.
Is my understanding from this last meeting was that the Village of North Hudson was looking to do a non-renewal to leave the service by December 31st of 2018.
But that's what was requested of us if we wanted to get out, if it was acceptable to the city, city council. That's who's got control of this. Yeah.
But I don't believe there was a date in that letter of leaving by the 31st.
Well, no, and that's again, that's if we would like to get out of the contract as early as possible, because that frees up money for would free up money for next year. Whereas but that's again ultimately up to the council. I mean, that's why we didn't put a date. If you wait a year or something like that, and we get out at the end of a year, I mean that's what we're waiting for is this council direction.
Okay.
We had to get out of
Thank you for clarifying that.
We had to stop the rolling. That's why we had to send a letter by the 28th of September.
Got it.
Our
This
contract.
is, if you
Gotcha.
would say no, then that's then we're in for 4 years. I mean, that's where we're at.
Got it. Thank you for that clarification, because I was thinking that was the same thing.
Yeah, because
which Town of Hudson is a little different, right?
January 1st to December 31st, and
I get that.
then
Get that.
to be out by the end of the year, you have to have it in by the end of September, by September 30th in the contract. That's why those letters all had to be mailed. We just are saying.
Town of Hudson now, you're saying a date, though. You're saying
Doesn't make
December
it-
31st.
Part of the discussions in the 5-year contract, when that was done, was because you were on the hook for capital. I do not believe in this budget for 2018, we're carrying any capital forward into 19, are we?
We are, in the 2019 budget, we are carrying, was it 12,000, Bill? It was just a little bit. We have about 9 months of that last ambulance that we purchased.
I thought that was to be done in 2 years,
3.
last year.
No.
You changed that?
We didn't change it. It's always been 3.
Really? We always did 3 before, and I thought we did it 2 because the city was going to sell the service.
No.
So the city decided to do it different than what you told the commission. I'm sorry. There's no way I would mix that up. You know what I mean? I wouldn't. And that's okay that you did that, but so my assumption was we didn't have anything. But that was my assumption, was there wouldn't be any financial commitment. And even if you did let us out, we'd have to be responsible for that financial commitment. Just so you know.
That's up for interpretation on the contracts, yes. Right. But yes, the third ambulance, or the most recent ambulance that we purchased, will be paid off in August or September next year.
Okay.
So it's 12,000?
12,000
Total, right?
total.
I want to say Town of Hudson's share is what?
Maybe approximately
7?
7,000.
7,000?
Okay, which is probably right. Okay.
So you have a specific date
Yes.
of wanting to be released.
And the only reason for wanting is we're going to take a contract out supposedly with Lakeview. And as a consequence, do we want to continue to pay the city a per capita for the next 4 years for a service we're not receiving? And the answer is no, we'd rather not. And so if you're willing to let us out, we'd like to be out rather than pay that per capita. Because the way I interpret it, we will be part of the voting budget, and I would find it hard that you're going to want us part of your voting budget because we got skin in the game. If you're trying to determine a direction that the service wants to go without the partners, but leave the partners in to help determine your budget. Just, to me, that doesn't make a whole lot of sense. That's all. It would seem to me to be better to cut the ties and move on, move forward for both parties. But that's...
And you're speaking again for the town of Hudson with
for
that?
Just strictly the town of Hudson. But I know I am speaking for the city. I think for the city and the St. Croix EMS service, it would be better, rather than dragging us along. You know what I mean? It doesn't help the service.
Right.
You know what I mean?
I understand what you're saying.
Okay.
That's your position as the town of Hudson. Town of Croix, what do you feel?
Well, we haven't voted on shortening it, but we have talked about, you know, if the other two are getting out at the end of the year, then we would also want out at the end of the year, but we have not voted on it. It's only been a discussion.
Okay.
And you already said what you said.
We're
The city lets you out.
we're with the contract, and, you know, we would like to free up that money just like the town would, but,
And we're with you all the way to the end.
yeah.
It's just that we're going to use a different service. We're going to have two contracts. If that's your choice, you know, as a city, not Bill Ohms, as a city.
Yeah, right.
As a council,
Correct.
okay?
Okay.
Has the Hudson City Council discussed this, or
Yes, we have.
are they ready to share any outcomes of that discussion?
So we made a motion yesterday after a closed session, and that motion was to authorize our legal counsel to send a letter to the attorney of Town of Hudson for our answer on the contract.
For what was that?
And what is it? What's the answer?
That's all we voted on.
I didn't hear you,
Closed
Bill.
session.
You sent us a letter.
We are sending, the attorney of the city of Hudson is sending a letter to the town of Hudson.
Attorney.
Mm-hmm.
That says, do you know what that was, or nothing yet?
That's all within closed session.
Oh, okay.
You'll see the
Okay.
letter soon enough.
If I can make a request,
Yes.
I hate reading about it in the paper.
So then I would suggest maybe connecting with your attorney.
Okay. You know what I mean? When the attorneys
Yeah.
make a decision, I would hope that the municipalities would be involved in that decision rather than reading about it in the paper. And I can't tell you how often that's happened.
I would assume that this letter that is sent would be communicated first to your counsel, not to the newspaper. That would be my assumption.
I agree.
Okay.
But
So,
I'm just telling you, is I've done it the other way, both from the council and from
okay.
our people. You know what I mean? Because once you discuss it in a public hearing, it becomes public information.
So this was a closed session that we had.
I
And the
know, but
outcome from that
if we
closed
discuss
session.
it in ours, she'll be able to pick it up. You know what I mean? So either we have to go into closed session to discuss it.
That's your,
Usually
Your
it's
call.
made public after. You know, the closed session is a discussion.
Mm-hmm.
But coming out of closed session, you know, I was under the impression that you were going to make this public, what your decision was, because it impacts how
He did.
we work on it with our next, our next town meeting. So I'm a little disappointed.
Okay.
Is there any way that once the attorneys receive the information, that at least internally within the EMS commission, we can know what's going on before it becomes public?
And that was kind of my point.
Yeah,
It really was. You know, otherwise the commission is sitting there in the paper and my wife says, "Did you read this?" No, I didn't know that. You know.
I totally get what you're saying. I mean, it's not up to the attorneys, but once that any of us know any particular information, it'd just be helpful to know that as a commission member.
I agree.
Rather than hearing it externally. I don't know how
Maybe we should have a sooner meeting.
I agree, but it's going to be dependent on when your attorney and our attorney meet. And just so that everybody knows, their attorney's the same attorney. Just so you know what I mean? So he's part of the same decision. You know what I mean?
bill us both.
Yeah. So, how about, once I think I know there's something, we'll call a meeting, or whoever's chair will call a meeting,
Sounds good.
okay? Any other questions on that? That was 5, right? No? Yes. Okay.
Bill,
Wait a
you
second on,
No, that
I'm
was.
sorry.
That was
six.
6.
Yeah,
6.
yeah,
We're moving to
sorry.
5, is that
5.
correct?
Yes.
Can I ask another question? So, Village of North Hudson, Town of Hudson, and then Suzanne for Town of Croix. You said you discussed it. Is there a plan to do a vote here sometime soon?
No, we have a meeting on Thursday, but it's, we're not gonna have a vote. We're just gonna wait and see what, all these RFPs, turn out and what, what's decided by the city.
I was just
We're not doing
curious on what
anything
you said.
immediately, but I was hoping to take back to that meeting what the decision was of the city on is the city letting the town of Hudson out of a contract or not? I was hoping to take back that information.
I think what I heard though is, we may not be able to bring it back from here, but once you get the letter from the attorneys, then you'll know. And then if we communicate internally within the commission, then you'll know. What you can then bring to your.
I don't know.
Right, but it
I
won't
don't
be
know if I
until
know the
November.
answer to that question. I don't. Because it depends on what was in that letter. You know what I mean?
I understand.
That's fair.
Yeah, I thought that's why we had this meeting, just to find out the decision of the city.
I can
And now we're not
definitely
finding
say
out.
Correct.
the town of Hudson is moving forward to have a contract with Lakeview by the end of the year. And if we have to have a service contract with St. Croix EMS for the next 4 years, we will. We'll end up having to pay a per capita for a service we're not receiving. Okay? But I can tell you that that's the plan.
So I think the urgency, to your point, Suzanne, the urgency of that letter being sent to the town of Hudson is the timing of that request to be out of the contract by 12/31 of 18, which is why we don't have necessarily an answer. I mean, we just met yesterday about it. Does that make sense? And I know you were looking for an answer, and I apologize for that from the city's end, but we need to meet about that.
I don't understand your concerns, because you've already sent them a letter that says you're out.
We sent a letter that we are out at the end of 4 years.
Right. So what, the question is, like us, are you going to go with Lakeview, or are you going to stay in the service for the next 5 years?
Well, we don't know yet. We have to, the city may,
Doesn't matter what the city says.
But to Tim's point, it doesn't, are you suggesting, are you just wondering what's happening with the town of Hudson? Because now you're going to react to that?
we possibly might. I mean, I have to take back that information.
Got it.
So you'd stay in for the next 5 years and use St. Croix EMS services?
I can't speak to that. until we have a meeting.
Okay, but
decide
that should
We're
be
waiting to
your,
find out what
that
your-
should be your discussion. We've already decided we're out by December
we know
31.
that.
So your question, so when the service grows, your per capita will go up. It won't stay the same. It's just, you'll just, and so our interpretation is if we get out now, even if we're in for the next 4 years, our per capita cost should not go up that great, like it was anticipated in the 5-year growth, no matter what, because you aren't going to have the need for the volume of service that's there. Same or no?
What's that?
You getting out December 31, or are you staying in
Well,
the
you
full
sound
5
like
years?
they just sent the letter to you. They didn't send it to us.
But no, are you planning to stay as a North Hudson for the next 5 years with St. Croix EMS, or would you go?
Like I said earlier, that depends on the city would let us out of the contract.
So you'd stay in?
No, we would get out if they allow it. We'll stay in if we'll honor the contract. That's what we have to do.
I think what we're talking about is what-if scenarios here. It's sounding to me like the town of Troy and the village of North Hudson may leave St. Croix EMS if town of Hudson leaves. Is that
No.
a fair statement?
No, that's not accurate.
Okay. That's what I was hearing from you, Suzanne. That you may have that conversation.
Well, I can't say what our town is going to do.
Correct,
You know,
correct. But that's what I was
if you-
hearing you
if you
say.
if you let one out at the end of this year, the assumption would be that you let all three out. But that'd have to be voted on. We have to know, first of all, what are you doing with the town of Hudson before we make any decisions.
Okay. But your request is to be on board for the next 4 years.
Right now, we have voted to opt out of the 5-year rolling contract that ends December 31st, 2022.
Right.
No other decision has been made at this point. We need to know what's happening between the city of Hudson and the town of Hudson if you're letting them out at the end of this year out of their contract. That would have a bearing on our meeting and
Bearing on the
what we would
financials,
ask for.
potentially.
Right.
Okay. That's fair. Any other discussions? Okay. Number 5.
So I don't know if you saw in the last city council meeting, I brought forth about doing a request for proposal for the city of Hudson to explore at other options for contracting our services either in whole or part. So we are in the process of putting a request for proposal out in advertisement. And that process, just so you know, it's not out for advertisement yet. We are still working on the language around that. And so I understand Town of Hudson's position moving on with Lakeview, contracting with them starting in 2019. But I would like to ask the Town of Troy and the Village of North Hudson if you want to be a part of that request for proposal and the interview process therein and potentially decisions about St. Croix EMS.
We could be, I don't know what benefit.
Would you take it to your board, I guess, is my question.
The request to do what?
To come along with us for the proposal through the interview
for the
process. Correct.
Okay. Yeah, I mean, like I said, we're open to staying, what we did is to stop the 5-year rolling. That's
Yes.
what our vote was. We had no vote on if we can get out, right now we're under the understanding we are there for 4 years with Hudson EMS. If Hudson EMS or the RFP comes out with a proposal that is, quality of service, affordable, we'd be happy to stay. I mean, but that's where like I said, I've said numerous times at this meeting, if we would have had different, the proposal that we had to share the revenue, or the how much we contribute, that I don't think this would have been an issue.
And Troy, our chair knows that about the RFP, and we would like to be a part of that interview process. And everything's up in the air right now. I mean, we're only committed to be out by December 31st, 2022. And more or less the same thing that Stan has said. We're just waiting to see if you're going to come up with a service, that's a reasonable price and the quality of service is there. And at that time, a decision may be made as to how we're going to go or what we're going to ask for, And we're hoping that works out, that you have a good service. And I understand it may be partial or complete. It might be just management of your service. We have no idea what you're going to do right now, but we would like to be part of that discussion.
Okay. And I just want to clarify, you are not interested in joining us with the RFP, correct?
No, that's correct.
Okay. So part of my reason to ask that, right, is as we're working through that language about what that RFP says, would you feel comfortable if we incorporate your coverage area in the village of North Hudson and your coverage area currently as it stands in the town of Troy? So that when we're advertising it, we're saying this area. And that was, up until this conversation, going to just be the city of Hudson. But if you're willing to join us, then the language would spread out the coverage area, which gives us...
Then again, we'd have, I don't know what the RFP says or whatever, or what the costs and everything are going to be. The village does not have to be under contract. Everybody understands that.
Understood.
So we could, by doing nothing, we'll be covered. 911, calls will be covered in the village by Hudson or Lakeview, or whoever's available at the time. So that's kind of where we're at. But again, the community, we've got plenty of the EMTs and medics that live in the village and stuff like that. We like the community based, but again, it's affordability, and so. And again, Hudson hasn't let us out of, said, hey, you're going to be done at the end of this year. And I believe I said at our meeting, it's like, if we waited out, if it's a year, if it's 2 years, but what we wanted to do is make sure we had contract that we would be out of if this collapse, it was looking like collapse for a while. Now it looks like we're trying to get, at least we're not going over the gunnels yet with the sinking ship. So, I'm willing to, go with what we have.
Gotcha. I just want to clarify. And I'm sorry, I'm jumping back to 6 because I just want to clarify that you're not waiting for a response, right? I mean, you basically said to the City of Hudson, we're out of the contract 4 years. You're not waiting for a response from us to say, hey, we're letting you out now early, are you? Or are you?
We in fact are. That's was the understanding when we were told to, said add to get out early to the letter. Yes, that's just like Hudson. We're asking if it was good. We figured if you let one out, you're letting all three out. That's just kind of where we were at, and that's what it seemed to be. I mean, with the way the council voted on different things, it's like they don't really care if we're in or if we're out. That's at least that's the readings that we get.
So if you're waiting for an answer, if you can get out early, that directly goes to your question, I would imagine, about the RFP.
Right.
Yeah. No, if they would let us out early, we would go, we would, we could, that's a substantial savings to our budget, if we don't have that, the EMT costs that we can do other things with. We've got some critical issues up there now with our police force, and, we've got a lot of things going on, road projects coming up, everything like that. So, we're always looking for a way to try to save tax dollars and still provide good services to our citizens.
So what you're suggesting is if you're out of the contract, you're not going to contract at all?
I didn't say that either.
Yeah, okay.
We don't have to have a contract.
Correct.
So, if we can get the service, that people are still going to get service by 911, but their insurance companies will get billed accordingly.
Right.
Just won't be putting in the per capita to help to maintain the level of EMS that we have, with the trucks and everything like that. Yeah, no, that's up to the board too. I mean, if we to contract or whatever, I don't have that authority.
So is your decision, I think I'm taking on to what you were asking, is your decision then in terms of including the coverage area for the village and for the town, is that contingent on knowing if you can get out by the end of the year?
Well, again, the contingency isn't, that service area is still part of, that's set up by the state, and so we're in that area.
In terms of the RFP is what I'm saying. So making the decision, do you want to have your area in terms of coverage in the RFP, is that contingent on knowing if you're out?
I don't see where it makes a difference.
Yeah, it does.
It does in your description of the service area and population, I guess.
Well, I'm just looking.
And that's determined in the St. Croix County map. And so that's the service that gets the first call, right, Josh? So if your map shows that you're responding to St. Croix EMS in North Hudson, 911 call goes to St. Croix EMS. If the map shows that it's Lakeview, Lakeview would get the first call. Because St. Croix EMS goes out on service calls in other municipalities as a second call.
Right.
Not as the first call. So you want to know what areas they're covering first call, correct?
Correct. And I'm just looking this from would put a proposal, or an entity that would put in a proposal, right? Is they're looking at, that entire coverage area. As it stands now, if you're not with, then it's just the city.
As you look at that RFP, as you look at that RFP and coverage area, I'd tell Warren to take a camp and go to New Richmond and tell St. Croix County that you don't want to cover Warren Township. That gives us nothing. Because why would you want to drive to the other side of Warren, town of Hudson, when we're not even in the town of Hudson anymore? What's your thoughts?
Call volume we get out of there would be more than the per capita we would get anyway. So call volume is more important.
Is it?
But that's my
So you'd
opinion.
be willing to do it? Okay.
Whether you're covered by Lakeview or wherever town of Hudson's covered by, we're still going to get mutual aided out there. I mean, to the town of Hudson, so it's not like we're
No, the town of Warren.
we're driving through Death
The town
Valley
of Warren.
to get to Warren Township. It's not like we're driving through the Bermuda Triangle and hope we don't lose a truck somewhere. I mean, we got to go through other areas all the time. I mean, we've got to go through North Hudson to get to the other end of the town of Hudson. So, I mean, it
Okay.
is what it is.
So include it. But that map at St. Croix County is determined by, from best I can see by the service areas, because Troy got changed by River Falls without St. Croix EMS knowing at one point. Is that correct?
The way I understood it. That was back when Eric was here, so.
Yeah, it was a long time ago, but it happened.
So are the coverage areas in the RFP or not in the RFP? I guess we didn't have that.
That's what I'm seeking clarification on, right? I mean,
It has to be in the RFP.
Well, I think what
the
you
coverage area has to be in the RFP, and that's what I'm trying to delineate now. What does that coverage area look like?
We're still under contract, so you put it in there. I mean,
Got it.
if you let them out, they'd go.
Right. Same for Troy. We're still under the contract.
Right.
And you're asking us if we want to be part of the interview process.
Correct. But dependent on town of Hudson being out of the contract or not, if you're out of the contract, are you still with us for RFP? Does that make sense?
Well, we don't know at this point if we're going to be out of the contract. We haven't had a vote on it. We don't know.
Yep.
So I can't really say what we're going to do. It would appear to me if you're going to let one out, you would be willing to let all three out. We want the best service for the 1/3 of Troy. And if that's an RFP that, you know, if you sell St. Croix EMS and another service comes in, well, we'll have to decide, you know, if we're left out, if we get out, what service we want.
Right.
And so, yeah, we have to weigh, we have no idea what is being worked out with the town of Hudson and Health Partner, or Lakeview. We don't know if we would like that or not.
Can I have a simple question? If you sell a service, is it really a Hudson,
Decision? Yeah.
is it still a Hudson service, City of Hudson? Or is it owned by another service? Or is it just managed by another service? What are you looking for?
It kind of goes back to here. It's an exploration in
What are you looking
contracting.
for?
What are we looking for?
Yeah, that's my question.
Options is what they're looking for.
Then I would say the option are, you should have a service area for including them and a service area that doesn't in your RFP. Because if you're looking for options, you should consider that. Because they both have told you that if you let them out, they're out.
Right.
Which means if I'm doing your RFP and I'm proposing it, I want to know what kind of call volume you got.
Right.
You know, I'm just telling you how I would be if I'm on the other side reading your RFP, you know.
Well, first of all, I think we need to know the outcome here. Are you letting the town of Hudson out? We don't know that. That's the first thing we got to know.
Yeah, and I guess I missed that in the last meeting. I missed the fact that whatever decision is made with the town of Hudson, that it would be jointly between you and Village of North Hudson. I guess I missed that nuance. I heard loud and clear in that last meeting that you were not asking to leave early, period.
They hadn't.
And you were
voted.
questioning the town of Hudson why they're leaving early. And so I misunderstood
I was
that
hoping they
nuance.
wouldn't leave and that we could work something out, but we didn't know anything about your RFP at that time. And,
Right.
you know, this is all coming together, so we need to have all the information before we can make a decision.
Right.
And you know, it's not up to me to make that decision,
Right.
just to take it back.
I understand. I didn't hear loud and clear last time that you were potentially out, dependent. If Troy's, or if Town of Hudson is out, you're out. I didn't hear that in the last meeting, now I'm hearing it in this meeting, so it's kind of new information to me.
I can only tell you what's already been decided, and that's what I told you at the last meeting. What's been decided is that we voted to get out of the rolling contract, and that ends December 31st, 2022. We have not decided on anything else. That's what I said at the last meeting.
Correct. Now you're saying at this meeting.
Same thing, I'm saying it now. We need more information before we make any other decision. But we don't want to be paying a high per capita and be the only partner in if you're letting the others out. You know, so it would seem to me that you're either, I mean, we have to know what you're going to do. Are you letting the town of Hudson out? So then we would ask to be let out also, more than likely. And then it would be up to what happens next. What service do we have? Are you going to go ahead with an RFP? If you are, we might be interested.
Okay.
We're interested in the best quality of service, And, dynamic deployment, on my own personal feeling is that we risk, last week, or it was a little over a week ago, we had a terrible accident here on the bridge, and there was a backup of 3 hours. And also Highway 36 was backed up. And you have ambulances that, if you have a bad accident, all the ambulances are going to go there. And to try to get a backup ambulance here from Lakeview would be next to impossible, and the quality of service wouldn't be good. So, we'd have to rely on mutual aid that's coming from quite a distance to cover this hole as a backup. So those are all things to consider. First of all, we have to know what you're doing with the city of Hudson, or with the town of Hudson. And then we'll take it from there. I can't make a decision for our board. We have to vote on it, given the given the information that we know.
I don't know if you can answer this, but is the answer to that question in the notification from the attorney to the other attorney? Or is that not in there? As far as letting Town of Hudson out of contract early, is that information, is that answer in the notification from the attorney that you referenced? And if you can't answer that, I respect that. I just
Can't answer that.
can't answer that, okay.
More questions? Do you have any more?
No, I don't think so.
Anybody else? So are we done with 5 and 6 then?
I just want to belabor it for one more second here. So
That's okay.
It sounds like this is a critical answer for you and for you, right, Stan and Suzanne? So when we get that answer, however we get it, then should we reconvene immediately as a group?
Yes, I would
Pick
say
this
so.
up right where we left off? Okay.
That'd be good.
I just don't want it to be lingering
Well,
out there.
Let me ask you. Because it's a council decision, it's not a commission decision.
Which part?
Whatever the answer is, it would be a council decision about what happens and not a commission decision, wouldn't it be?
Correct, but that directly affects the commission, is what I'm hearing.
Oh, yeah, it does.
Right.
It always has. And as Tom used to say, we really don't care what the commission thinks. Unfortunately.
I understand.
Not you, Tom. McCormick.
I understand.
You know. So we can meet, but then it becomes public information. Does the council want that out before the council hears it? Is part of my question to you.
What?
Say that one more time.
Because I don't know what's in that letter.
Correct.
If we meet, it becomes public information here, unless we meet in closed session here
You need to discuss,
to discuss it.
you need to discuss as a town of Hudson
Right.
from that letter. Whatever that discussion point becomes, then we meet as a EMS commission.
Okay.
Does that make sense?
That's okay with me. Do we need to meet in closed session so the council doesn't hear it via the paper?
You as the town of Hudson?
No,
It's a commission.
commission. Because once the commission meets, it becomes public information unless we do it in closed session. And then the question is, can we meet in closed session on that discussion? Because I don't know what's in that letter. I'm sorry, it's chasing your tail, because the state only allows certain things to be done in closed session. You can't just arbitrarily say, we want to meet in closed session. Okay, we'll just schedule it and have the meeting for the
Sounds
commission.
good.
Well, I think you should just have a meeting, and after you know what's in the letter, you'll know if it should be a closed session or not. That can be determined later.
Okay. Okay. All right. Discussion action on the minutes for September 25th, regular EMS Commission meeting. I move we approve the minutes as presented.
Second.
I have a point of discussion there. The Village of North Hudson, it says that a letter was sent to opt out early from their 5-year contract with St. Croix EMS by the end of 2018. Actually, it was to opt out of a 5-year contract. And in the letter, it does state, if possible, they would like to be let out earlier by the end of 2018.
That wasn't, you're correct, that wasn't the letter, I missed that.
Yeah, this sounds like you went out at the end of 2018, that's it. But that isn't really what was said at this last
So
meeting.
what does your letter say, Stan?
Oh, that, the lawyers and Melissa sent that, I didn't read it, but it was, if we can be, if the city would allow us to be out by the end of 18, we're out.
It was the same as yours.
Yeah.
Word for word.
Oh, was it?
Yes.
Yeah, I think, yeah, we do have the same attorney. I'm sure he billed us twice.
The names were changed.
So really, after the period, it should say, if the city would allow us to?
That would be accurate. And again, we'd have to vote too. I mean, EMS is on my agenda until this gets straightened out, because, yeah.
Do you meet next?
What's that?
When do you meet next?
We meet on the 30th. We can't meet on the first Tuesday because of the election, so we moved it up to the 30th this month. So our November meeting is the 30th. And we meet here the 23rd ahead of that, so I mean, I'll hopefully have more information for our meeting there.
Okay. Does that work for you then?
Sure.
That
Yeah.
change? Any other
Yep, good
changes?
catch. Thank you.
Okay. All those in favor of the motion as amended indicate by saying aye. Aye. Opposed, like sign. Motion carries. Thank you very much. The last thing, not even quite the last thing. New chair. I move Bill Alms be appointed as the new chair of St. Croix EMS.
Second.
Motion's been made and second. Any other recommendations?
Motion to close nominations.
Second. All those in favor of the motion to close signify by saying aye.
Aye.
All those in favor of the motion to elect Bill as the new chair indicate by saying aye.
Aye.
Thank you very much. You are the new chair. And it makes sense, Bill. It really does. As it's moving forward. It
Okay.
does. It
I just
does.
want to make sure that,
No, it does.
because I thought the chair should be somebody that is one of the partners.
When I had thought is when Jeff Johnson was discussing this, I even thought maybe I should resign even off the commission. And I don't really need to do that. But it made me feel uncomfortable chairing it. You know what I mean? It did. It just did. Okay. The next date is the 23rd at 7:30? Okay.
Or sooner.
Or sooner.
Well,
Yep.
yes.
Pending.
Depending on what it is, which we don't know what it is. Okay. Anything else? I move we adjourn.
Second.
Motion been made and second. All in favor, say aye.
Aye.
Aye. We are adjourned. Thank you very much. Nice short meeting.